I'm Dr. Sonia Thomas, a urologist, and today we need to have an honest, straightforward conversation. If you're over 60 and you've experienced climax, felt the pleasure, but noticed no seminal fluid, this video is for you. Perhaps it happened once and left you worried. Maybe it's been happening repeatedly, but you've stayed silent out of embarrassment or fear. I want you to understand something crucial. What's occurring in your body isn't a loss of masculinity. It's a medical signal that needs proper interpretation. Stay with me for the next several minutes as we explore the causes, the warning signs, and most importantly, the medical solutions available to restore your confidence and well-being. Before addressing the absence of fluid, let's briefly review how the process normally functions. Your body operates as a precisely coordinated system. The testicles generate sperm. The seminal vesicles contribute the majority of nourishing fluid. The prostate supplies protective secretions. This combination prepares in the urethra. At climax, specific muscles contract in rhythm to propel the fluid outward. It's a rapid event resulting from intricate synchronization between nerves, glands, and muscles. Here's something vital to understand. Climax and ejaculation, while occurring simultaneously, are actually separate processes. Climax represents the neurological experience of intense pleasure. Ejaculation is the physical expulsion of fluid. Most men perceive them as one unified event, but they're distinct mechanisms. Today we're focusing on what happens when the pleasure sensation occurs without visible fluid. This is called dry ejaculation or dry orgasm. A man reaches climax, experiences the characteristic pleasure, yet notices minimal or zero semen release. The missing physical component, always considered an integral part of the experience, creates confusion and distress. Many patients describe this to me as feeling incomplete or empty. This perception generates worry and reluctance to discuss it with anyone. What's essential to grasp is that your capacity to feel pleasure, governed by brain and nerves, can remain perfectly intact. The alteration occurs in the mechanical aspect of the process. This doesn't indicate failure or lost virility. It simply means one aspect of your body's function has shifted. And this shift has identifiable, specific causes. One of the most frequent causes is retrograde ejaculation. Imagine a small valve positioned at the bladder's exit. During climax, this valve normally closes completely to direct semen forward and outward. However, when this valve fails to close properly, the fluid follows the path of least resistance, flowing backward into the bladder instead. The man experiences normal orgasmic pleasure, but because semen doesn't exit externally, it feels dry. A telltale sign is noticing cloudy urine after sexual activity, as the semen has mixed with it. This happens for several reasons. Prostate or bladder surgeries, such as procedures for enlarged prostate, can affect the nerves controlling this valve. Certain medications for high blood pressure or mental health conditions can relax this muscle, producing the same result. Additionally, neurological conditions like long-term diabetes or spinal injuries can disrupt the nerve signals coordinating valve closure. I remember one patient who, following successful prostate surgery, was devastated by this change. Once he understood it was purely mechanical, and that his potency and desire remained unaffected, his relief was profound. Diagnosis is straightforward, typically confirmed through urine analysis immediately after climax. While this may affect natural fertility, your intimate life can remain completely fulfilling and satisfying. Another significant but less recognized cause involves blockage of the ducts transporting semen. The seminal vesicles, positioned behind the bladder, produce most of the semen's volume. If these ducts become obstructed, semen volume can dramatically decrease or vanish entirely, even when production remains normal. Think of a blocked highway. Traffic exists but cannot pass through. Blockage causes include past infections like untreated prostatitis leaving scar tissue, small calcifications similar to kidney stones forming and obstructing passages, or cysts and other anatomical variations. Symptoms can be subtle. Some men report pelvic discomfort during climax or observe their semen becoming progressively thicker and less abundant. Diagnosis typically requires imaging studies like transrectal ultrasound, allowing visualization of the seminal vesicles and ducts. The encouraging news? Many obstructions respond to treatment, either through medications addressing underlying infection or minimally invasive procedures clearing the duct and restoring normal flow. The third major consideration involves hormonal factors, particularly testosterone. This hormone drives male reproductive function. It regulates not only desire and sperm production, but proves crucial for proper prostate and seminal vesicle function. When testosterone drops significantly, the entire system suffers impact. Initially, you might notice only reduced semen volume. Over time, additional signs emerge. Diminished libido, less firm erections, decreased orgasm intensity. More broadly, fatigue, muscle mass loss, and mood changes become common. It's a mistake attributing this solely to aging. Often it's a treatable medical condition called hypogonadism, a hormonal deficiency requiring intervention. Diagnosis occurs through blood tests measuring hormone levels. If deficiency is confirmed, hormone replacement therapy can restore not just semen production but also energy, desire, and overall life quality. We've discussed causes with available solutions or management strategies. However, as your doctor, I must warn you that dry ejaculation can sometimes signal more serious conditions. That's why monitoring other symptoms proves crucial. Certain urological cancers can obstruct ejaculatory ducts. Prostate cancer, as it grows, can block semen passage. Bladder cancer, if positioned near the exit, can interfere with the process. In these cases, absent ejaculation may accompany other signs like blood in urine or semen, or pelvic pain. Progressive neurological diseases represent another important cause. Conditions including multiple sclerosis, Parkinson's disease, or nerve damage from poorly managed diabetes can disrupt communication between brain and reproductive system, causing this and other dysfunctions. So understanding when to seek immediate medical attention is critical. If dry ejaculation appears suddenly without explanation, or accompanies pain, blood, fever, or genital sensation loss, don't delay. These indicate potentially serious issues requiring urgent medical evaluation. Beyond physical aspects, we cannot overlook the profound emotional impact this condition carries. Many men equate ejaculation with virility and performance. When it disappears, feelings of inadequacy, anxiety, and frustration emerge. Men in this situation often begin avoiding intimacy, fearing judgment, or feeling incomplete. This emotional burden is genuine and can severely affect self-esteem and relationships. The most crucial step breaking this cycle is information and communication. Understanding this represents physiological change, not personal failure, lifts enormous weight. Your capacity to feel pleasure, achieve erections, and enjoy intimacy doesn't depend exclusively on fluid presence. Your intimate life can and should remain a source of joy and connection. Speaking openly with your partner and seeking professional guidance are steps restoring control, confidence, and life quality. Let me leave you with practical guidance. First, don't dismiss changes in your body. Sudden dry ejaculation warrants a urologist visit. Second, maintain control of chronic conditions like diabetes and hypertension, as they directly impact vascular and nerve health. Third, embrace a healthy lifestyle. Regular physical activity, balanced nutrition, and quality sleep form the foundation of overall health and consequently intimate function. Fourth, in the silence. Discussing what you're experiencing, whether with your partner or physician, is liberating and creates pathways to solutions. Finally, follow medical recommendations, whether through treatment, medication adjustment, or lifestyle modification. Professional support is your strongest ally. In conclusion, absent ejaculation doesn't signify the end of your intimate life or testament to lost masculinity. It's your body's signal deserving attention and investigation. Understanding the cause, whether mechanical, obstructive, hormonal, or neurological, is the first step toward peace of mind. I've witnessed countless men regain confidence and joy after receiving clear diagnosis and action plans. Your vitality isn't measured in fluid volume but in your health, well-being, and capacity to live fully. Don't allow doubt or shame to prevent seeking answers. Timely action can transform your experience, restoring the security and connection you deserve. If you found this information valuable, please share it with someone who needs to hear it. Leave a like to help this message reach more men. Subscribe to the channel and enable notifications so you don't miss our upcoming men's health content. Remember, your health isn't just about living longer. It's about living well. Stay informed, proactive, and above all healthy. I'm Dr. Sonia Thomas, and remember, your best years can absolutely still be ahead of you.